what I think music therapy is, it's about making contact, clinical contact. So we want to establish trust, familiarity, success with creative, often improvisatory activities that tap into the strengths of, say, a child with autism spectrum disorders. Some autistic children have a lot of difficulty working in a structure, so we might provide more, once again, creative, open-ended, free-form activities where it's not just right and wrong, let's do it over again, but anything they do might be relatively successful as long as it's in a broader context, such as playing a metallophone without throwing the mallet, so they could play anything they wanted rather than trying to learn a song. And this is in part the difference between music education, which is learning the song, which is developing music skills, which is developing information and knowledge and understanding of music, versus using music as a tool to achieve therapeutic goals. Music therapy is most effective as a form of almost play therapy with sound. So we're dealing with vocalizations, that might not be verbal, it might be pre-verbal. We're dealing with use of instruments for self-expression, sometimes movement, but one has to be creative and improvisatory with it. It's not like just teaching 7-year-old Johnny how to play this old man. It's about following the ability and the needs and the direction of the child. We're all wrapped up in our cognitive thinking heads about, got to do this by then, and thoughts. And so many of the children I work with are about sensation and how does it feel? How does it sound? With music therapy, we're not so concerned with taste or smell, but certainly, movement, visual sense, and hearing sense, and to kind of explore that in a subtle, nuanced way. Some children not only have sensitivities, but it's like preloaded software. They are innately musical. It might be rhythmic, it might be vocal, it might be instrumental. Sometimes it's all of the above. And part of the goal of the music therapist is to tap into that, to find that strength, to find that inner musicality, to find that inner intelligence, and develop it so it carries over beyond the music therapy session and plugs into the classroom or the home or many activities, play activities. I've been around music since I was a kid, and it brought me to tears as a kid, and it had a unique power to inspire me and touch me. And maybe I'm just a wimp, but at 60 years old it still has that unique power. And it just, the cliches, it says things that words cannot. But in dealing with disabilities, it brings out strengths and qualities that words and other rote kinds of activities and other behaviorally based activities. So it touches the identity, the individuality, the creative spark, and the need for expression. We all want to be heard. I think from birth till death, we all want to be heard and understood.